All right. I think we are on. Hello, everyone. Good morning, good afternoon, good evening, depending on where in the world you are joining us from. And I am Masi Juma, and this is a point where I say welcome to Real Talk, where we have honest conversations about the future of maternal and newborn health. So it is a big pleasure to be back here after Real Talk 1. And if you joined us in Real Talk 1, I would really love to see you leave something on the comment. Let me know on the chat box. Were you here in Real Talk 1? If you are, really, really nice to see you again. So in Real Talk 1, we explore the workforce gap and how AI and technology and digital tools can transform maternal and newborn health. So today, we are tackling a question that many of us talk about in hallways, WhatsApp groups, founder meetings, but almost never say out loud. Innovations, digital health innovations, tools are transforming healthcare. But who exactly is supposed to pay for them? We're going to talk about money. We know the promise, we know the potential, but we also know the reality that innovations get piloted, even scaled. But when it's time for governments to take over, I would say the money disappears. Is it inability? Is it unwillingness? Or is it that innovators are solving for need when governments respond to demand? Or is the entire financing model outdated? I'm just putting the questions out there, and today's panel will help us unpack all of it. Okay, maybe not all of it because 1 hour is just not enough for us to have these conversations, but this is a very good place for us to start. And before I go to the panelists, a little bit of housekeeping. Please drop your comments, drop your questions in the chat. I'll sample some of them as we go along, and you can also tell me where you're joining us from. And if you want translated captions, just click the CC down here and select your language: French, Spanish, and Portuguese. Now, today I'm joined by three brilliant leaders who sit at the intersection of innovation, financing, and government action. And we have Aparna Kamath, who leads Women and Girls Health at Grand Challenges Canada, shaping investments that bring MNH innovations to scale. And then we have Rubayat Khan, the Director of Health Programs at Endless Network. He's an entrepreneur, an AI enthusiast, yeah. And then we have Jean Philbert Nsengimana, the Chief Digital Advisor at the Africa CDC and former Minister of Youth and ICT for Rwanda. Thank you so much, the three of you, for being here today. And I'm really looking forward to see how this conversation goes with the three of you. Now, before we jump in, I want us to ground this conversation in a bit of reality, and I'll talk about prompts. Prompts is I would say, an SMS platform in Kenya that sends life-saving messages to pregnant women and new mothers. It's not high-tech AI, it's simple, proven, and it works. And it reaches about 2.4 million mothers at, I would say, a lifetime cost of just under $1, about 0.7, between 0.7 and $0.8. Now, the government of Kenya, this is under the county government, covers only 15% of the operational costs. 15%, so 85% is not covered by the government. Remember, I said this is something that is proven, it's simple, and it works. 2.4 million mothers. So the question isn't, does it work? It is, why won't the system pay for what clearly works? Most innovations do survive the pilot stage. We've seen that. And this shows us that the scaling problem is not just pilots anymore, because these and other innovations teach us that the pilot stage, they survive. The real cliff edge is post-pilot continuity, where governments should step in, but rarely do. That's our backdrop. And let's talk about it. And I will start, I'll invite our panelists on the virtual stage, and let's talk about what's possible. Like, we have more innovation in MNH and health right now than ever, from diagnostics to algorithms to platform. Aparna, what is one innovation you've seen in the last year that genuinely excites you, and why? Very briefly.
Thanks, Marcy. I think the one innovation I've been really excited about in the last couple of years is Maziwa is working on ensuring access to breastfeeding for women in Kenya. They are the founder, Sahar Jamal, is actually ex-Jacaranda, but she's working on developing a breast pump that's hands-free, discreet, usable at work. Breast pumps are not particularly new or innovative, but I think what is innovative is their approach, is their business model. And I wanted to raise it because of the business model, in which they're particularly targeting low-income day wage laborers and testing things like a rental model, um, a model in which employers provide supports for breastfeeding within factories and plantations and other areas of work where technically generally employer supported M&H practices are rare. And I think therein lies the innovation. So that's something that's excited me, is that more and more innovators are thinking beyond the product to innovation in the social approaches and the business models.
Mm-hmm. And Rubias, does that resonate with you? Does that bring anything to mind that you would love the people here to care about?
Thank you, Mercy. And of course, I think mm, oftentimes the technologies only half the battle, right? There's so much more that needs to happen before those innovations reach scale. So the example that Aparna gave is brilliant. What I wanted to talk about in terms of an innovation that is really exciting for me is AI, but especially in the context of self-care companions. I know several organizations across the world are working on this, and I don't want to pick out any particular one, but I think within our health systems, we have had always this problem of people lacking agency and autonomy. It's often hard to reach quality providers. People rely on low skills and expertise from the providers that are accessible to them. But suddenly we are in a world where people can access cutting edge clinical expertise from the comfort of their homes, right? Sometimes in a conversation by voice in your local language. So my parents, for example, my parents are 70 plus years old. And for the last 2 years, they've been double checking every one of their health advices from their doctors or every changes to their drug regimen with ChatGPT, right? So I think the level of access that AI tools now provide to people for cutting edge clinical expertise and personalization, I think that is really, really exciting and could fundamentally transform the way people interact with the health system. I just hope that more people within the health system actually engage with that opportunity in a significant way.
Thank you, Robert. And just to say that this conversation, Robert has talked about AI and tech, but this goes beyond technology and AI. It's also about other tools, other innovations that really don't directly point to tech and AI, but still they are not able to be brought to scale. Jean, do you have an example, or does something come to mind when we talk about that? Sorry, you are on mute.
So my favorite example of innovation that really saves mothers' lives and children's lives is a zip line, the delivery of blood and vaccinations to kids in remote areas. And that started in Rwanda in 2016 during my times in government, and then has scaled up now in 5 other countries, including Ghana, Nigeria, Kenya, and so on. And this is really significant because that innovation was able only to scale because it was funded to the question of who pays. It was funded by a VC funding, which is what the company used to get started. But then when they had some prototype, they got some philanthropic funding to go test it in the real world, in a country, in Rwanda in this case. And then later on, the government liked the solution, embraced it, and paid for the delivery of the solution, and they later on even invested in the solution. And so it is only that partnership between the three actors that the innovation was able to take off. And if you look, there is a lot of research that has shown that this innovation was able to save lives. My favorite example is a mother called Justin that I met in the southern province of Rwanda with her baby, her son Aristide, who was 6 months old. And then she told me the story of how when she gave birth, she had just 15 minutes to live because she was losing blood, and the blood group that she needed for transfusion was not available at the hospital in the southern province where she was giving birth. But within 15 minutes, a packet of blood was able to be dropped and her life was saved. So when I saw the smile on the face of her son, 6 month son, it was really heartwarming to see that what we say here, like the big partnership between private, public, it actually impacts people's life, do save lives. But Mercy, you said the transition from pilot to scale is not the problem. I want to push back a little bit against that because while some
Yes.
of those companies like Prompts in Kenya have made it and Zipline have made it, the graveyard of pilots is still full, and there are so many other companies going to the digital health graveyard. So I think we should step back a little bit and still double click on that transition from pilot to scale, because I think there is a lot yet to be said. Yeah, and my colleagues here on this talk
Yes.
also have a lot of insight, especially Grand Challenges Canada. We've been discussing about how do we get governments, for
Yes,
example,
allow me
to
to stop
embrace
you there. Allow me
innovation.
to stop you there. Allow me to stop you there, John, because you have literally taken off. You have taken off in this conversation, but I want you to pause there because you raise a very important point that we will talk about in very few. That is, and you call it the graveyard of pilot is still in full. Both Apana and Rubayat, you'll have to respond to this. And if you have any comments, please put them, or questions, please put them on the chat. Jean says the graveyard of pilot is still full, but we are well aware, Jean, that it's not just programs just or projects just don't end at the pilot phase. We have really good examples of those ones that went beyond the pilot phase. They were adapted, but scaling is just a problem. Scaling has been an issue. And this is where I ask you guys, is it that especially in low and middle income countries, governments can't pay, or is it just they can, but they don't want to? Because even the example you're giving, Phil, of the zip line, you say it took off because three actors came together and did that. Did I hear you mention the government anywhere?
Yes,
Mm-hmm.
the
And what
government
was
in
it?
Rwanda was part of it. Yeah, absolutely.
Okay. And that is
Yeah,
why it is sustained up to now.
exactly.
Let's look at other countries. What is the problem? We can't pay, or we can pay, but we just choose not to as governments.
Mm, mm.
And you can answer that very briefly, then we go
I
to a panel. Very briefly.
Back to me.
Yes.
Oh, okay. So um, this brings to mind almost a similar conversation I was part of at the World Bank 3 years ago, organized by IntraHealth. So the title of that conversation was "Who Dies, Who Lives, Who Dies, Who Pays, and Who Decides?" And you realize that most of this dysfunctioning dislocation is because those who pay and those who decide are different. So
Good stuff.
in every case, almost whoever gets the value of what the innovation delivers should be the one to pay. And at the end of the day, could be the patient, could be the health system, or the of the business person who's providing the health services. Who I think we should really unpack who gets the value and see whether those who get the value pay. But ultimately, even when it is government paying, it's a citizen, because the government collect tax from the citizen, give it to government. Now the government needs to deploy that money in the where it makes the biggest impact. And then in the case of AI-based innovation for maternal health, I think there has to be an understanding of what is the value of a life that is saved, and why would the government feel urgent and important to deploy that money to save that life.
Rubayat, do governments see the value? Is it an issue of value really here? Are we talking about value? Because we are talking about
uh,
2.4 million mothers being supported and all those big numbers. Is it a value thing?
of course, I think we have to think about value, but I will question on the very premise that, for example, in many countries we see governments spending less than 1% of their GDP on health on the first place, right? So the fiscal space that you have for procuring innovations after building the hospitals, training the health workforce, like all the things that you need to do within the health system, 1% is simply not enough. And so we see a lot of fragmentation within these markets. In the country Bangladesh, which I'm from, only 0.74% of GDP gets spent on healthcare. So if we don't have the dollars to spend, it's actually a moot point of whether we are spending it on high quality innovations. I also want to point out that governments sometimes there are challenges in terms of whether private sector is actually solving for the problems that the government is seeking to solve, and whether the governments and the private sector actually trust each other, right? So oftentimes you have philanthropy funded startups or social enterprises going in and solving problems, oftentimes in highly crowded spaces like AI. Nowadays, I'm seeing an AI pilot left, right, and center. But whether that actually solves a real problem for the health system, there's often no conversation with the government, right? Early on. And so you end up with this disconnect where you have maybe of the 100 pilots that you do, maybe 5 are successful, but those 5 successful pilots need to have a prior conversation on whether it is actually solving the right problems, and have the conversation early with government so that there is a pathway to scale. But I think there are many other challenges that we can double click into, including the fiscal space, including procurement processes, including trust gaps between governments and the private sector. There's actually a lot to unpack here. So I'm looking forward to hearing from Aparna and John.
Hannah, now that Ruba has mentioned you, please feel free to come in. Don't wait for me to prompt you. Just jump in.
Okay, we're waiting for your permission. Okay, all right.
No,
So
don't wait for my permission. Let's go on. Let's go on. And
yeah.
Hannah
Yeah.
can just then come in, John.
I just want to add, I think, one point, because I agree with what John and Rubaiyat are saying. And I just want to bring this back to the fact that I think every time we mention this, we talk about constrained fiscal space. There is a constrained fiscal space. There's nothing we can do about it. But I think one of the main issues that faces governments in all of this is decision paralysis. At the end of the day, as John mentioned, there are so many pilots that are happening in this space. Innovation is moving faster than the pace of decision making in government, for better or for worse. And I think that is the main challenge that's facing us, in that by the time you've been able to make a decision with all of the information that you need, innovation has moved forward, particularly in the technology and the AI space. So I think something that we really need to think about critically is, how do we ensure that government systems have the capacity to keep pace with innovation and to make decisions at the pace that is required? One of the things that I do want to mention in thinking about innovation, in the very early stages, I think every innovator needs to think about, what is it going to take for government integration capacity? I think, Mercy, you mentioned Jacaranda right at the start. For better or for worse, that is one of the best examples that we have today about government uptake and integration. And I think the thing that they were able to do is, right from the start, think about, what is this going to cost the government? What will we need to change within the data systems within the government? What capacities will the government need in order to uptake this? There is so much that needs to, beyond just the innovation itself, there's so much within a system that sometimes needs to adapt in order to integrate a new technology, a new idea. And not every innovator thinks about that critically. And so that helps the government make a decision about, at the end of the day, what do we have the capacity to integrate, and can we move at the pace of this innovation?
Yeah, and I agree with both the points on decision paralysis and also the fiscal space. Believe it or not, 25 years ago, the same question, Mercy, you asked about whether government see the value and are ready to put their hands where their mouth is, was discussed in Abuja. And there was something called the Abuja Declaration, which concluded, recommended, mandated government to spend 15% of their budget on health. But 25 years later, the reports are less than 5 countries in Africa have actually made that target. There are similar targets in agriculture, food security, and many other constraints that have made it extremely difficult for the government to deliver on some of those commitments. So it's really not that the government don't understand, because they signed up on this one, but they are just constrained. I think we can, when I look at the years that I spent in the government, I know some of these constraints are very, very difficult. And the dialogue, the conversation between the innovation, basically building an ecosystem, because it's not just the government, it's government, private sector, innovators, and academia and others. The lack of that dialogue also leads to this problem of underfunded innovation. And perhaps then coming to this question of the capacity to integrate the innovation within public health delivery systems comes in that conversation as well. So one thing that we're doing concretely as Africa CDC, just to give you an example that we see the problem and we want to do something about it, is we deployed something called the Africa CDC marketplace, digital health marketplace, to reduce that uncertainty and decision paralysis by identifying those innovations that are already demonstrating impact, that are ready to scale, and then present them to the government so that if they are presented with 1,000, they don't have to go through everything. We've already gone through that, and we say, these are the top 20. If you want to get engaged, this is how you can go about it.
Thank you. Thank you, John. And I don't want us to...
love Sorry, Mercy. I just wanted to jump in and double click on what John just said, because I think this is such an important facilitation role that needs to be played in the ecosystem, the curation of successful innovations, really presenting it to governments in a way that they understand, and with the right kind of metrics and evidence that they would need to make the decisions. Innovators are often not, having been an entrepreneur myself, like it's often really hard for an innovator to navigate that regulatory landscape, to understand what different countries' regulatory landscapes are, what they actually need, and how governments think. Those are just not things that innovators think about on a day-to-day basis. So it's really, really important to provide that kind of a facilitation role. And I'm really glad to hear that Africa CDC is doing that. There are other players like Health Tech Hub Africa, like I3 Investing in Innovation, who are trying to play that kind of an intermediary role between governments and with private innovators. And capacity building needs to happen at both ends, right? There's innovators need to be taught how to navigate this regulatory landscape and how to generate the right evidence. At the same time, on the government side, there needs to be work done on procurement, on increasing the fiscal space, thinking about how to match their demands with innovation. So there are all these kinds of different pieces that needs a facilitation role. I also wanted to say that when Jean was pointing out that there's a graveyard of pilots, I think that's absolutely an essential part of also the innovation journey, right? Like, of course, not all innovations will be successful, and there will be a large number of pilots that fail, and that's perfectly fine. What I think I would point out is that we're not often taking the lessons from the failures properly. So just to continue the analogy, maybe we need better gravestones, which tell us what exactly failed and what we can learn from it, so that next time we don't make the same mistakes and we're not duplicating and reinventing the wheel all the time.
Right. Thank you for that. You know, when you say that it is okay for us to go to through pilots and for them to fail, wait, but is it okay that 87%, and I'm quoting this from a report by Path that is called Beyond Pilotitis. It was done in 2022. It came out in 2022 that says 87% of digital health pilots in low and middle income countries fail to scale. 87%, that is almost 8, almost actually 9 in every 10 digital health pilots. They fail to scale, and they call this pilotitis. And a couple of people have put on chat comments about pilot. James Nadella from Last Mile Health in Ghana says, there's a challenge about piloting to scale. Our experience has been that who implements during the pilot and who gets credit during the pilot is a main determinant of the success of the scale-up. And he says, if an aid-funded NGO is implementing during the pilot and expects the government to manage the scale-up, that is flawed thinking.
Absolutely. I think like really figuring out who actually manages scale and implements at scale is really, really critical in addition to thinking about the payer, because sometimes governments don't have the fidelity of implementation to be able to scale something that's been piloted in the private sector. In Bangladesh, for example, BRAC, which is a nonprofit organization, runs about 15,000 primary schools, and manages a huge portion of the education sector within the country. And the government has partnered with BRAC to be able to leverage its expertise instead of trying to take it over and run it at scale. So there are other mechanisms to do this, but I think that trust piece between the government and the private sector needs to be really thought about carefully.
I also want to say, I mean, it's a framing of the question about the role of government, and governments are really important, especially in low-income countries where health is still essentially a social sector, and that is predominantly funded by government and dominated by government, but it doesn't have to be like that. Some countries have already seen their health sectors being driven by the private sector. So I think there is also an increasing necessity to understand what is the role of the private sector. It's just not the government. There is a lot of private clinics, pharmacies, and even the community health workers models have started shifting from being owned by the government to some non-for-profit, and BRAC is a good example. And there are even others like Healthineers in Uganda and so on and so forth. So there is a tendency for that also to migrate to the private. So there is a case for B2G, business to government, which is what we seem to be focused on. But also there is a B2C, which we shouldn't ignore. There are a lot of AI, especially AI-based innovation that are direct to consumer and that have scaled. And perhaps maybe that's what made prompts. I don't know exactly the details, but I think from the innovation perspective and scaling perspective, we should also sort of examine carefully, can we shift the responsibility a little bit away from government and put a bit also on the consumer side, and government can perhaps organize. So in countries like Rwanda, my country, and Kenya, health insurance is something that is now becoming universal. So people pay, but then in return, government deliver the service. And when government are well funded through those kind of mechanisms, then money becomes available to absorb this kind of innovation.
Thank you. And I know when we talk about piloting and all the conversation around piloting, this can be a rabbit hole. We can go on and on and on, but I just want to read one comment from chat. Joanne says the question is whether they were pilots that showed strong results or pilots that showed that the intervention did not work. A pilot that shows that the intervention did not work has achieved exactly what a pilot is intended to do, and then it is correct and the intervention should not scale further. So that is okay. Now, I want us to move beyond this a little bit and talk about something I mentioned when we were doing the intro, the need versus the demand mismatch. You see, innovators come and design systems that I would say the population need, like there is an actual need and desire. There's a gap that needs to be, that this innovation can bridge, yes? But am I right to say that governments only pay for, and at this point I would say political demand? What does it take to turn a proven innovation into something a government asks for, demands for, and not just what you as an innovator has seen as a need, Rubaiyat, because you've been on both sides? How do we change, or how do we do a proper analysis of need versus demand? Is that an issue for you?
I think I don't know how you're thinking about need versus demand. To me, they're kind of interrelated, but I feel like
I lost
governments.
you. I'm not sure if I'm the only one.
Can you hear me?
I
Yes.
can hear Rubaiyat very well.
I can hear Rubai.
Oh, great. Okay.
Okay.
Okay. Oh, yeah. That's good. Okay.
So yeah, I was just saying that I'm not sure how you're differentiating between need and demand, but I would argue that governments need to have a clear articulation of what the need of the health sector is, or what their mandate or their vision is for the health sector, rather. And ideally, in a democratic country, that should reflect the people's priorities, right? But oftentimes, what we see, I can give you an example from Bangladesh, because we were in an authoritarian regime for such a long time. One of the prime minister's pet projects was to build 15,000 community clinics across the country, and the billions of dollars were spent on this project. But before and after, the percentage of people that were going to the informal private sector, the drug shops and pharmacies, as Jean was mentioning, did not change at all. It was 70% before and 70% after, right? So people's needs were not really reflected in the government's priorities. That's kind of the key takeaway from that. So I think governments need to do a good job, and hopefully in democratic governments, hopefully they do a good job of identifying the pulse of the people and really articulating those needs carefully. But sometimes we don't even see that happening well, right? So which is why innovators and funders can come in and they might not have the right direction on where to innovate, what problems to solve. If the governments articulated those needs carefully and their priorities carefully, then it becomes much easier. So one example that I can share from my recent work is in Ghana, where the president said that he wants to make universal primary care free for every Ghanaian. And there was a real mandate for also integrating the private sector and pharmacy especially into that mandate. So there's actually now a clear piece of work that is cut out for us as innovators and funders to be able to deliver on that promise, right? So those kinds of priority settings from the government really help shape and steward the role of the private sector and philanthropists in this space.
Yeah.
Mhm.
And if I have to chime in on this question, I think it brings to mind a
Sorry,
framing that
sorry, just a minute. Can I ask Aparna to come in because I've seen she's typing something on the chat, and I would love you to say this out loud. Then Jean can come in.
Sorry, I was responding to something in the chat, which I think was related to our previous point, actually, because I think Rubaiyat, maybe in the discussion that you were having, you were talking about government transition, and it was just the point that handover or transition. I think this is to James's original point, is not always the right end goal. I think there's an author who's written "What is your end game?" and I'm forgetting who the author is, but handover to government is only one of the potential end goals. There are partnerships to scale. There are private sector plays to scale. There are B2C models. There are so many other models, and I think we cannot ever place the entire onus of scale on a government partner. That's never going to make sense. Rather, what we're looking for from governments is to eventually play the role that many of the private philanthropies or bilaterals are playing in the early stages, which is to be the partner, the support, and to provide maybe the infrastructural or capacity or systems needs for an innovation to scale, but not to take over an innovation in itself. And I think that's a really important and clear distinction we do need to make in the discussion we're having. So I wanted to respond to that in the chat.
Mhm.
Thank you, Aparna. Jean, go ahead.
Yeah, I mean, I don't want to break the flow because I was going to bounce on the point that that Rubaiyat had made around your question on need versus demand. So the framing of this could also be one of the things that my friend Dr. Amitaka always says is there could be a gap in the market, but is there a market in the gap? Because people always confuse the two. A gap in the market in the sense that the solution or the innovation doesn't exist. But should the innovation exist, is there demand for it? Is there anyone who's ready to pay for it? And we've seen many solutions coming to fill a gap in the market without first checking whether there is a market in the gap. So I can give an example. You can say, oh, we need an app to show us where is the nearest health facility because such app doesn't exist. But who's going to pay for that app? The people in villages know the information is in their mind. They do not need to pay to know where to go because they know already, but there is no app. So many innovations come to address those kind of needs of gaps. But when there is no gap in the market in the gap, no one is paying for that solution, then it's a failure on arrival. And I think we shouldn't also look at all those, the graveyard, some of the dead solutions in the graveyard need to be there. That's where they belong. They have proven it doesn't work. That's okay. But I think we also need to look at the percentage, how many of those innovations end up failing. And that's if you see that the mortality rate of innovations in Africa is higher compared to Silicon Valley or compared to India or China, then we should question why is it higher here? But the fact that some innovations die is really part of a healthy ecosystem functioning. I agree with that, Rubaiyat.
If I can jump in there, John, I love that. I love that phrase and that framing. But I want to play devil's advocate myself in this, in that it's hard to tell right at the start whether there is a market in the gap. And I think that is where we should place the onus on those who are able to take that early risk in funding innovation to help innovators identify whether there is a market in that gap. The innovation is not just that product or service that they're developing, but in that business model to find a market in the gap. And I think that's what's important. That's where we can play a role. Because if there is a need, I mean, Rubaiyat said earlier, what is the difference between need and demand? And the only difference is that someone is willing to pay for a need. That's the only difference between need and demand. And so what we need to identify is, where is that willingness? How do we identify it? How do we create it? Can we find a market in the gap? Because we can't just let a gap be. We can't just let people be and communities hurt because there is no market there. I think I mean, it's a very capitalist view to take, and unfortunately, that's a society we live in. But we do need to find where there is that space for us to make a difference and create a market.
Yeah, and there are so many market failures. So when mothers keep dying, when the technology to save their lives is there and it's affordable and it's good, but it's not finding its way to the market, that is a market failure. So we should also acknowledge that, and that is primarily the job of governments to meet the market failures. No other stakeholder, individual or collective, can really remediate to a market failure. That's why the governments are there. But also, yeah, there are also market creating innovations. So we should also appeal to our innovators, not shift again all the responsibility to government, to also come up with those market creating innovations. And there is a whole book about it by our friend Efosa Ojomo, The Prosperity Paradox. So it's a subject that has been really studied. But I think the framing of the market in the gap and gap in the market can allow for a very, very rich conversation.
Thank you. And you both, Apana and Jean, you talk about the question about the willingness or the readiness of somebody to pay for something, right? And it brings me to the question, like, why are low and middle income country governments rarely the primary purchasers of innovation? And I will tie this question to a poll that Align MNH did on LinkedIn about a week back. It's been running, and the results just came in, and they asked, by 2030, what percentage of digital health innovations will be funded by low and middle income country governments? Shock, only 6% of the respondents feel that more than 50% of digital health innovations will be funded by low and middle income governments. Only 6%. Jean, don't we have faith in our government? Or where is the faith? Because how can 6% feel that only 50% will be by low and middle income government? Less than 10%, 42% say it's less than 10%, 42, 10 to 25%, 32. You see, I think that's alarming. Where are we? Like, what is the direction? Why aren't our governments the primary purchasers of innovation?
I can tell you I have the answer for this one. Having been in government and having worked or done research on procurement, public procurement is something else. People don't really understand public procurement. So public procurement can only pay for two things, either the time of a consultant or goods. And the way it is structured, it was structured as far as goods is concerned, structured to buy roads, to buy buildings, to buy things that you can define ahead of time what you need. What is my need over the next 3 to 5 years? And then you can put it in a budget. A budget cycle lasts for a year or even 2 years to get something on the budget to be funded by government. By the time, first, not only the people in government procurement don't know the needs, they don't even understand what the market, the innovation market provides, so that they can put it in their procurement plan. So anything that is not in the procurement plan doesn't get purchased, regardless of how beautiful it is. and the innovation moves fast. So to answer that, some governments have started going away from the classic procurement methods that are pushed by the World Bank. By the way, that's not even something that African countries invented. It is pushed and somehow imposed by the World Bank to follow a certain process in public procurement for good reasons. I give it to them for roads and electricity and buildings. But when it comes to innovation, it completely fails. Governments have tried, it has resulted, I've seen myself, into multiple failures of vaporware, software that are installed in government that no user has ever touched for years, and the government's still paying, and that has affected the trust that governments have in innovation. So governments have started um, testing or experimenting with something called procurement for innovation. So Rwanda has done it, Senegal has done it, I think Tunisia has done it. Some countries are even putting laws to say, let's go for a challenge-based procurement. Periodically, government will say, these are our needs. They don't prescribe what the solution should look like. They say, these are our needs. Come up with ideas and solutions to us. Then we will see which one we pay for. Some of them come actually as free. If government says yes to a certain regulatory facilitations, because the people can pay it if the government doesn't stand between the innovator and the client.
Rubaiyat, as an innovator, does that approach work? Does it make sense? Do you think that will increase the percentage of innovation that low and middle income countries will be purchasing in the near future?
I think it could, but I think it requires strong governance and good processes and innovative thinking from governments, which is not something you can take it as a given, right? Not many countries have that. Rwanda is possibly an exception to that in the African continent. I've seen in Bangladesh, for example, like in my own work, how corrupt the procurement processes can also be, right? When you try to pilot something and you've even partnered with the government and you've tried to scale it, there are kickbacks that need to be paid. And there were situations where we had to walk away from a procurement process because we were not comfortable with that kind of an arrangement, right? So there are all these challenges. But I think if governments, as I was mentioning before, if governments do a good job of defining its priorities, saying that these are the needs and challenges that we need to get solved, and have enough faith in the private sector and innovators to say, we welcome you, come in, we challenge you to kind of come up with solutions to this problem and demonstrate for us that your solutions can actually solve our problems. So I really like what some countries are doing with innovation sandboxes. I think Rwanda has one, Jean would know better. So where you actually create a more protected regulatory environment where there's government oversight, but some of the laws are actually relaxed a little bit so that innovators can play more freely and actually demonstrate results without being constrained and hamstrung by various regulations. So I think those kinds of innovative approaches could be really powerful in creating the right level playing field and creating the right environment for innovators to come in and help solve government's problems.
Thank you. And I know, there is something around, we've talked about financing, but I want to throw in another phrase here. When we talk about innovations and all these things, because so many of you, Rubaiyat, are out there coming out with innovations, like there are so many of them. So does the problem at all lie in the fact that there are so many innovations? Like, do we need fewer innovations or better financing pathways or better collaboration so that we are not having three organizations looking at solving or rather giving prominence to one thing in the same geographical area? Where is another loophole that we need to fix? Very briefly.
I don't think there's anything called too much innovation, right? Like I think innovation is always generally good, but I would say that there's a lack of coordination and really a coordination failure right now. For example, I would pick on the AI example. The same organizations in the world, some darlings of the development sector, are getting funded by 3, 4, 5 funders to do basically the same projects, right? And that's not really healthy for the ecosystem. I think it's really important that funders coordinate and share information amongst themselves. If there are dead ends, if a pilot has been tried and failed a couple of times, we should not be funding more pilots on that same topic, right? So those kinds of coordinations could really help streamline some of the investments in the space. But generally speaking, again, if there are challenges that the government needs solved and there's a clear articulation of that, it's not a problem that three innovators come in with different solutions to that problem and compete for the best spot, right? Because then the government has an option to choose which one of them actually best suits their needs.
Mm. The other perspective on this one is what gets funded. Innovation goes through different stages, and innovation will need that enabling environment, as Apan has talked about. And you see there is a preference towards funding innovations that has sort of a shiny, quick, low-hanging fruit type of results. Those get preferred by the donors because they can now go back and say, this is what we've produced, give us more money, because the donors also have their own donors. But the piece that is neglected is the invisible public digital infrastructure or enabling environment, the laws and the regulation or the procurement frameworks that also need to change. And there is a little, not sufficient investment that go into those foundational pieces because nobody sees it. But I've had some conversation recently with some of the philanthropic investors who are starting really to take seriously the need for building that enabling environment, whether policy, regulation, or even technology, public digital infrastructure that will help more innovations becoming successful. And I think that's a good shift. But I think also to the coordination failure that Rubaiyat you talk about, it's something that everybody has seen. The question is who's doing something about it. And I also want to say this is something also Africa CDC we've started doing something about it. So I chaired the Health Tech Summit, and last October we held the Development Partners Roundtable. And I remember it is the head of Gates in Africa, Dr. Paulin, who said, Africa CDC, keep doing this because we needed like a safe space between the development partners, the donors, to come and discuss and then align our intervention and be able to put money to solve one problem as opposed to everyone looking for their own thing and invest in that, which result into the kind of situation that Rubaiyat you've just highlighted.
If I can jump in, I love that we're coming to some like the solutioning ideas here, because I totally agree with what you're saying, both Jean and Rubaiyat. Mercy, to your original question of why do we have such little faith in governments to take on innovation? I think it's because we're piloting a lot of innovation, and then governments have these long procurement cycles. So once they see effectiveness in an innovation, it's going to take them 3 to 5, 7 years to actually integrate it. And in the middle is this valley of death where no one wants to fund the innovation. The funders are done because they've piloted, they see it works, they say, now government, it's your turn. And the governments need time for that. And some of these efforts, like bringing now, donors together at the same table with the government to say, okay, we're seeing all of these outcomes. They match with the outcomes that you're looking for. How do we take these together to scale? Ensures that governments say, okay, here's what we can do, and we can deliver it 5 years from now. Will you continue to support and fund it and help us develop the systems that are needed to get it to scale? And I think that is the partnership model that's really going to work. I think we've been engaging with folks like the Africa CDC and the European Commission and various donors to think about how do we come together and talk about this and engage with governments on these are the outcomes we want to see, we want to fund. Great, we'll help take those innovations to scale. That's the solution here. It is actually quite simple, but it means getting a lot of people together at the same table, which is the most difficult thing for us.
We have to, Aparna, totally agree with you, but I also want to point out that there are political cycles, right? So when governments change, priorities change, and the bureaucrats change, and you have to build the relationships all over again. Like I've faced that so many times from both Endless and my previous work that, we should not discount how difficult that is.
And that's true in the philanthropies as well. I mean, everyone is working on their own 3 to 5 year cycles. And that's creating the challenge, I think, on on all fronts. Innovators have their own 3-5 year strategic plans, at which if they don't meet certain milestones, funding's getting pulled. So we're all going to have to move towards a long-term strategy. I don't want to place the onus just on governments.
Great, thank you. We have all just 7 minutes remaining, and like I said, this is not a topic that we can finish in 1 hour because this is just a starter, and we will definitely continue these conversations elsewhere. To the three of you, very briefly, what does this conversation mean for maternal and newborn health from where you sit? The issue about financing, about new innovations, about piloting. What does it mean for maternal and newborn health?
It means urgency. It feels so wrong to keep watching the situation of maternal death and the newborn death and not do the right thing, especially when the right thing is known. So, for example, you cannot boil the ocean, but we can start taking some steps to say, can we eliminate this issue? Can we eliminate the deaths that are due to the fact that, for example, blood is not reaching to the women who are giving birth in remote health centers? The technology that is affordable than what we use is there today, and it's been piloted, it's even scaling. But so it means urgency. Let's isolate a few things that we can do. And for me, as far as Africa is concerned, there are things that we can do faster, cheaper, easier if we work collectively as opposed to working individually.
I want to take a slightly contrarian view to that, John, with all due respect, because I think we have had a vertical approach to programming for so long, despite Alma Ata telling us 50 years ago that we need to focus more on building systems and the primary care infrastructure, right? We have, and for good reason, even for a lot of countries now, there are certain things that are so urgent that those needs to be prioritized. If a country has a maternal mortality rate of 200 plus, then they absolutely should be prioritizing that as a vertical. But at the same time, I think we should not forget that we have come a long way, right? As a world, we've come a long way on things like malaria, TB, HIV, maternal deaths, newborn deaths. I think it's really time to focus on building systems and not do more vertically focused infrastructure. Especially after the fall of big aid, we can't really afford that anymore, right? We really need to focus on building systems at the community level, empower people and communities to take better care of their own health. And I think the best way to do that, the most cost-effective way of doing that, as countries like Costa Rica, Brazil, and others have showed us, is to actually focus on building strong and resilient primary and preventive care systems. We have focused so much on sick care that we forgot that the goal of healthcare is actually to keep people healthy, right? So there's really a different way of thinking about this, and I think AI also provides us another opportunity to really reimagine this. I hope that we take that opportunity and use the current crisis also as an opportunity. As they say, never waste a good crisis. So I hope we can finally fulfill the promise of Alma Ata.
Yeah, I might add to Rabayat's point. I think it's a really good one. And for myself, I think what I see, at least in the near future for MNH, is a focus on maybe the innovation that we have shown works. I mean, in the last few years, we have shown that with the innovations that we have today, we could reduce things like postpartum hemorrhage by 60%. We could reduce rates of preeclampsia, like we could detect preeclampsia early in like more than 50% of cases with things that we have available to us already. So what we need is not more innovation, I think, in terms of products and services. What we need is more innovation in the way that we get these things to people on the ground. I think that's our focus for the next many years, so that we continue to address the high rates of maternal morbidity and mortality, and we continue to innovate in the ways that we reach people. There will always be new shiny objects. I think someone said that in the chat as well. But I think there's continued space for innovation in what we have today as well.
Thank you very much, Apana. And there's so much on the chat, like you say, Dr. Ann Kihara, who I'm a very, very big proponent of maternal and newborn health. She says that, for what we need, it's about innovations are critical for maternal newborn survival. We must include innovations. I know you raised the issue of, what kind of innovation, but again, still, we're talking about, yes, we need the innovations. Some are there, but who pays? And how do we get them to pay, including the government? I think that is one of the key things that we wanted to address today. Like I said, when we are on Real Talk 1, Real Talk 2, our goal here is not to give concrete solutions and put them on the table, but to start a conversation and really get us talking and integrating the things that interrogating the things that we rarely talk about in boardrooms and in conferences and all that, but we mention and they are at the back of our mind. So today, it wasn't about innovation is failing. It's about financing and the financial systems and how they can be reworked to really make innovations work, especially in newborn health. So there's the issue of our willingness to solve the problem, the demand gap, the outdated, I don't know what to say, assumption that government will always pay, because even the best tools will remain stuck somewhere between pilot and permanence. And we need to figure out that period somewhere in between pilot and permanence. That's where the problem is when it comes to financing. We will continue this conversation at IMNHC 2026 in Nairobi, where innovation financing will be one of the key things, front and center. So be sure to look that up and don't miss those dates. And we'll also share a blog summarizing today's insights, including questions we didn't get to because there have been so many and so many chats. So thank you so much for being here today, for taking part in Real Talk 2. And please do let Align MNH know what other talk you would really love us to focus on Real Talk. But as always, it's a real pleasure to sit in these conversations. And a huge thank you to you, Apana, to Rubayat, to Jean, for your insightful conversations and contributions, and to all of you for joining us virtually. Until next time, see you.